In this second film in our series on transforming social norms for sexual and reproductive health and rights, we describe how to design a social norms transformation project. A successful social norms transformation project is ready to start after careful planning and thought. Intervention mapping is an approach developed by behavior scientists to guide the design of social norms and behavior change programs. The approach recommends the following 6 steps. Step 1. Problem analysis. Conduct a need assessment or problem analysis, identifying what needs to be changed and for whom. Conduct your formative research to better understand the problem and your target group. If feasible, get someone with expertise in behavior science to conduct the research. Conduct a literature review and understand what recent studies and behavior theories have concluded about your topic within your region. We recommend that you establish a working group that includes members from within and outside your organization. Consult with this working group throughout your project. Step 2. Define outcomes and objectives. Use your research from step 1 to map the reasons why the behavior you want to change exists in the community. These are called the behavior determinants. Then identify which beliefs should be targeted by your project. Step 3. Program design. Select a behavior theory from step 1 that will help you to design messages to address the behavior that you want to change. For example, you may find that the reasoned action approach works well for your program. Design messages using guidance from your theory and research findings from step 1 and 2. Step 4. Program production. Together with your working group, plan your program execution and design the tools you are going to use. Step 5. Program implementation plan. Identify who you will work with first and what the outcomes should be. Step 6. Evaluation plan. Generate an evaluation plan to monitor the projects and to measure impact and process evaluations. Clearly define your indicators and evaluation questions. So, how would these steps look in practice? Let's take the example of a social norms change project on child marriage. In step 1, you decide that you want to decrease the rate of child marriage in a community and start researching the topic. In step 2, you analyze your research findings and discover that a key behavior determinant of child marriage is that grandmothers expect girls to marry at a certain age, and that the belief driving this behavior is thought to be stated in a religious text. In step 3, the outcome of your research is that grandmothers are the drivers of child marriage in the community, and that holding community dialogue sessions with them to sensitize them about the dangers of child marriage may decrease its incidence. And some sessions with grandmothers and religious leaders may help to confirm that the expectation of child marriage is not in religious texts. In step 4, you develop a curriculum to guide the community dialogue sessions. Once complete, you pretext the tools and adjust them based on the outcome of your test. In step 5, you reach out to existing grandmother groups and discuss a program implementation plan with them. You will have implementers, grandmothers who educate other grandmothers, adopters, grandmothers who used to promote child marriage but don't anymore, and maintainers, grandmothers who become advocates against child marriage. In step 6, you evaluate the outcome of your intervention through a variety of tools. For example, analyzing monitoring and evaluation data, focus group discussions, and/or an external evaluation. Social norms transformation programs that are embedded in solid research and executed strategically and systematically are most likely to be successful. It is crucial that you take your time to design your social norms change program. In the next and final film in this series, we will share some examples of successful social norms change projects and their amplified changes thematic areas.